Clerk, the next item.
Independent evaluation of the Alexandria Fund for Human Services.
Good evening. I'm Kate Garvey, the Director of the Department of Community and Human Services, and I'm joined by Federica Gutierrez, who is our Deputy Director of the department and also the leader of the work on the Fund for Human Services. I'm also very pleased and grateful to have Dr. Michelle Haynes-Baratz, the Managing Associate for Community Science, joining us at this late hour to present the results of the comprehensive study on the Fund for Human Services. We've come before you to share the results of the independent study completed by Community Science. First, we'll review the background of and the purpose of the Fund for Human Services. Then we will provide some highlights of the study, the recommendations, and then suggested next steps. And just in terms of the key elements that we hope to get through is that you will hear about the highlights again, the very comprehensive study that was attached to the docket tonight. We hope to receive feedback from you all and direction, and then we are also hopeful that we do hear feedback from the community during the public hearing this Saturday. So next, just in terms of reviewing for the community, a little bit about the Fund for Human Services. This has been a critical vehicle for expanding city human service delivery system through a competitive grant process. The fund was formally established in 2014, and it has supported the work of nonprofit partners to respond to the critical needs across our community. The funding priorities have been based on the goals and desired outcomes of key strategic plans, including those found in the Age-Friendly Plan, the Children and Youth Community Plan, the Community Health Improvement Plan, and the ACPS Strategic Plan. With the impacts that we've chosen related to those plans, we focused on strong early childhood development, career readiness, social connectedness, safety, economic security, access to comprehensive health services, and prevention and remediation of crises. And again, it was critical for us through the fund to be using the data and the goals and decisions of the respective plans so that we were really focusing on that work that had already been done related to the needs across the community. It is important to understand that $1.9 million of this funding this year is funding 48 programs, and that more than 30,000 residents have been served using these funds. Tonight, we'll be talking about the independent review of the fund. We will discuss why the review took place and what the goals of the review were, and then the specifics of the review and our next steps. For the FY 24-26 grants process, we faced very challenging circumstances, and many of you were part of that discussion, where the growth in the number of applicants resulted in the funding requests of exceeding the $1.9 million by $3.4 million. The implications of the shortfall, along with the timing and impact on the applicants, indicated the need for a review of the process and the fund as a whole. In a memo that we received from then Councilmember Gaskins, we were directed to address 5 key areas: the scale of human service needs in Alexandria, the intended result of the fund, the essential services needed to arrive at this result, the best channels to support these essential services, and a process for evaluating the success and impact of the fund. Further, the expectations for the independent review included engaging an outside consultant for the research, working closely in partnership with community partners and stakeholders, taking a review of the neighboring jurisdictions that have similar grants processes, the sharing of the findings with council, and the opportunity for community response through a public hearing. Through an informal competitive process, DCHS selected Community Science, a minority and women-owned business with 25 years of experience in research and evaluation that has been rooted in a mission that uses science to promote justice and equity. I'm very pleased to now pass this over to our very apt and wonderful partner, Dr. Haynes-Baratz, to walk us through the process, findings, and recommendation.
Thanks so much. Good evening, Honorable Mayor Gaskins, members of City Council. Thanks so much for being part of this discussion tonight. So before we dive into the recommendations, I'd like to provide you with a quick overview of our methodology. So in partnership with the DCHS staff, we developed a mixed methods approach, which integrated both qualitative and quantitative data to assess the research questions. And frankly, there were quite a few of them outlined in the IRFP, but they really boil down to 3 goals. We really wanted to understand the impact of the current fund, what's working, what's not, understanding best and promising practices, both from the literature and also other jurisdictions, to consider possible alternative funding models, and then also developing an understanding of what truly constitutes essential services. So to do that, we really wanted to leverage the strengths of multiple data collection methods and multiple sources to provide a comprehensive understanding of the various issues. And so towards that end, we engaged in various activities. These included a landscape and document scan. So we, reviewed current AFHS practices, public data, academic and practitioner literature to really provide context on the scope of the fund and funding mechanisms that exist for essential human services. We conducted a number of stakeholder focus groups as well as interviews, both with the city's nonprofit partners, but also with DCHS program staff to seek their understanding and perspective on what constitutes essential service delivery and the grants process as well. We also interviewed neighboring jurisdictions. We conducted interviews to provide comparative insights into funding mechanisms and best practices with 5 neighboring jurisdictions. And then we also did a survey with community partners. So that same group of folks that was invited to those focus groups were also invited to participate in the survey to capture the data, to further explore their perceptions of essential services, the AFHS, and funding recommendations. So I'll go ahead and start off with the recommendations, and I'll start off with this proposed definition of the essential human services. And ultimately, we'd like to start with this definition because it really provides the scaffolding for the subsequent recommendations that follow. And so I'll read that off for you. Essential human services are those that meet the fundamental needs necessary for survival, stability, and well-being. Rather than a dichotomous classification of essential or not, services exist on a spectrum. At the most basic level, they ensure survival by addressing the immediate bare needs of food, water, shelter, and safety. The next level supports continued survival or stability by preventing harm, promoting health, and enabling economic and social participation. At the highest level, they foster mobility, resilience, and community engagement, collectively known as thriving. Rather than a fixed set of services, essential human services depend on contextual factors such as geography, culture, and societal conditions. So that's a lot of words. Let me break down some of the key elements, if you will. So really, everywhere that we looked, across the board, whether it was neighboring jurisdictions, the literature, we really found that things are not really considered essential or not essential. They really exist on a spectrum. And so that spectrum we see as going from surviving to thriving. And so that's where those 3 levels really come from. You have the level of surviving, which is addressing those basic immediate needs, food, water, shelter, safety, sort of those emergency must-haves. The next level, if you will, is the stabilizing, so preventing harm, promoting health, enabling economic and social participation. And that 3rd level is really the thriving piece, where you're talking about mobility, resilience, and community engagement. And so it's clear that it's important to have a shared understanding of what an essential human service is so that you can all move forward in terms of agreeing on what to fund and not. And really, I would like to underscore that grounded in both the literature and stakeholder consensus in terms of this idea of spectrum. There is no universal definition of what constitutes an essential human service, but these features really seem to bubble up no matter where it was that we looked. So with that as our first recommendation, I'd like to turn then to the recommendations in terms of the restructuring of the AFHS. So the first is that we recommend that we use competitive grants to fund programs that focus primarily on stabilizing and thriving. So that's that 2nd and 3rd level that we saw in the previous slide. And note that we're not leaving out survival. We actually have a recommendation that survival be addressed elsewhere other than the AFHS primarily, and we'll get to that. We Recommend that AFHS recipients provide novel service delivery that is not duplicative of other services offered in the community, and that partnerships amongst community partners are also encouraged. And this really comes out of two lines of thinking. Ultimately, there is a bit of a legacy issue that we found with the fund. You are not alone in this. Neighboring jurisdictions have also named this as a sort of perennial problem, if you will. And so it's important to figure out how to use this limited resource to explore new possibilities. And then secondly, complex social problems really require partnership and collaboration to solve them. No one organization can do it all, and so we wanted to really think through how to encourage collaborative approaches and build the capacity of the nonprofit ecosystem in the city. We also recommend that you prioritize 1 or 2 key service areas per cycle. So rather than spreading funds too thin, focus on the most urgent community needs based on a data-driven assessment. So it's a limited resource. We all know that you can't quite boil the ocean, and so how is it that you're going to prioritize what is most urgent at the moment? We recommend that the fund make fewer and larger grants to maximize impact, that individual award amounts are maximizing program impact rather than funding numerous small projects. And so equity can sometimes look like spreading the wealth, but the issue is that it can be a very big lift for an organization if the funding amount is too small. And so it's really about that impact component. We also suggest that the fund continues to maintain a 3-year grant cycle at minimum. Bottom line is change takes a long time, as I'm sure all of you know. And so this will allow for planning and implementation and so on and so forth. Enhancing performance monitoring and accountability to allow for data-informed decision-making. So really thinking through what success looks like in terms of your metrics and following up with those. Lastly, but certainly not least, we would recommend that you all employ direct contracts outside of the AFHS process for persistent conditions related to survival that are not otherwise available in the community, and for communities and conditions where funding disruption would create instability for critical services. So those services that are truly about food, shelter, safety, and so forth, that would not otherwise be provided, the recommendation would be to consider direct contracts outside of the fund. Next slide, please. Our third recommendation would have to do with exploring the feasibility of increasing the total amount of the AFHS funding to meet demand. The funds have ultimately remained static for a decade, while the demand and the cost of delivering essential services has increased. And perhaps a grantee that we interviewed said it best when they said that flat funding is really reduced funding. We would also suggest that you introduce a cost of living adjustment for multi-year grants to ensure service continuity, and really that is consistent with what other folks are doing in neighboring jurisdictions. Finally, our fourth recommendation is really around grant application and review processes, and it's about creating a fair and transparent process. So publishing a clear application rubric, enhancing that review process again so that there is transparency, ensuring sufficient time for the application process so that folks can plan accordingly, and also providing structured post-application support so that folks are able to execute their projects and their funds appropriately. And with that, I'd like to turn it back to Kate and say thank you again for your time. I know it was a very long report, so we just covered the highlights of the highlights, and happy to take any questions.
So I'll wrap it up, but I'm sure we'll have many questions. So in terms of what our next steps that we're proposing and we're looking forward to are, as I said before, we are hoping that we'll have community response on Saturday during the hearing. We were really pleased about the engagement of so many, we are so fortunate to have so many strong nonprofit organizations and partners here. So to be able to hear back from them directly about their viewpoint about the recommendations and how we move forward. with that input and joined with the guidance that you all give to us, our hope was we would be able to develop a plan on how we would move forward, and we would return to you in September with recommendations and suggestions, and that would then inform the next grant cycle for the 27-29 season. So that's how we're envisioning the next steps. Yep.
Thank you both for the study and the work and the presentation. Any comments or questions from my colleagues? I have one or two, but go ahead, Councilman Chapman.
No, I appreciate the presentation. I will say, I think this is maybe the third time we've kind of looked at this, and a lot of these are consistent in terms of conversations that have come up in terms of that process, whether it's the size of the fund, whether it's the size of the grant. I'm always challenged by that particular one in terms of the size of the grant and the limited number of groups that are supported. That's not right. The groups that are supported, but there's still a number of others that might be a much smaller organization and things like that. I think it doesn't seem kind of common sense to say that, hey, we're going to support less with more money versus spreading it out wide. I think, I'll be curious to see if we have anyone come on Saturday that has not received a grant and kind of has conversations about what that process is like for them. I think their stories are impactful as well. Not to say that the stories of those who've received grants aren't, but I think as we continue to look at kind of the smaller organizations and the place they hold within the community or communities that they impact, I see that kind of going against what we are trying to do. Even though, no question about the data and kind of the alignment of larger grants being more effective, I still have kind of that small place in my heart for the small nonprofit that's just getting going, connecting with the community, and still needs a small amount. And so I think ever since our partners at Alexandria School System kind of ended their grant program, leaving kind of another less opportunity. I think that still is something that sits with me. I'm not saying that any of the recommendations are wrong. It's just something that I keep in the back of my mind because I've had conversations with, some very well-meaning person that is starting a nonprofit, has found a niche, but that niche is still very small. Still impactful, but very small. And so as we consider this and move forward with next steps, that still sits in my mind about how do we still have a place as we are a small community for those smaller growing nonprofits.
And we have seen in other models where there's somewhat of a set aside for mini grants, so that it would be maybe a combination of expansion for larger and fewer, but also setting aside for that $10,000 grant or other things like that, just exactly for the reasons that you say.
Thank you.
Mayor Gaskins.
Thank you, Vice Mayor Bagley, and thank you to staff and to the consultants for the presentation. I really just wanted to first thank you for the work that has gone into this. I know all of the focus groups, the survey responses, and the many other meetings that you've done to really make sure that we were coordinating and in conversation with our nonprofit community. It's really helpful to see that in the data. I had 3 quick questions. One, in recommendation 2, it talks about requiring recipients to provide a novel service delivery. I just want to make sure that when we say novel, the recommendation isn't that they always have to have kind of a new way of doing things. And I'm thinking about a group like Meals on Wheels. There's only so many different ways you can innovate that there's a system for how it's going to be delivered. And I think an organization like that, I wouldn't want to be adding additional hoops that makes it more challenging for them to maybe do the core function of the work that they're trying to do.
Thank you.
Thanks so much for the question. I think that's a an excellent one. I think that what we might recommend is that if something is critical to service delivery that is relied on by the city, that one might consider the direct contract route to continue to offer that service.
Okay. That's helpful. I want to maybe think on that one a little bit more. I guess the other question I had was one of the ways it talked about measuring impact was the number of people served. I'm curious, beyond number of people served, what were some of the other impact measures that were considered?
So those were the only measures that were actually available to us in the context of collecting the data in terms of impact, and then collecting also community responses in terms of those nonprofits and the stakeholders in terms of understanding their perception. So at the moment, it's the number of folks that are served that is the data that's collected. It doesn't mean that that's the metric that I would necessarily recommend as the most important. Certainly feels like it's an important piece of the puzzle, but it's not it was the only one that we had available to us in the context of what's being collected now.
But I should point out that for the individual grantees, they do have, they're following a logic model. There are impacts for their particular projects each time. So I think this was in the aggregate, but for each grantee, they are required to show impact related to the services they're providing.
It might be helpful.
I'm missing the point. Sorry about that.
No. I think this is more for the future as we begin to really continue to measure the impact of this fund, whether it's doing some sort of analysis of the logic models that we receive, or if there's some way to quickly have people check a box like, I don't know, this is aligned with the Children and Youth Master Plan. This is aligned with the Community Health Needs Assessment. This is aligned with our age-friendly plan. I think some way to start to get at beyond just who we are serving, I guess beyond just how many people we're serving, how we are serving, and how that's moving the goals of the other plans and targets that we have in the city. So I think that would be sort of something to move to.
Sure.
And I think it would be great if, go ahead, Kate.
Sorry. We do actually look at each of them under the goal area and what they're doing related to move that, from all children and youth are school ready, the socially connected. So in each case, we are saying their work should be advancing these 5 under one of the 5 goals. But I definitely hear what you're saying in terms of specificity too, in terms of impact, as well as sort of how do we demonstrate that in the aggregate.
Yes, because I think what would be great to have at the end, of the next cycle, is X amount of grants, total amount of money, total people served, and then some snapshots of the outcomes that we are moving or changing. And then the last question I just had was, do we have, and Director Garvey, this might be for you, do we have any way of thinking through what's the current administrative workload on staff with the program as is, and then sort of how that might compare to some of the changes that are being proposed here? And is there additional capacity or infrastructure needed to implement these changes?
I think we need to think about that right now. We have a position that is we're about to fill that would be focused on this. At this point, Federico has carried all the water on this project. So I think we do have to take a look at what's the capacity, as well as in the event that some of the projects would move toward direct contracts, that would require additional resource in terms of contract management. But I think I would need to get back to you in terms of the specifics on those demands, if that makes sense.
Yes, no, I just want to be mindful of staff load in implementation. And I'll just close again by saying thank you. I'm really excited about this. I was going back through the previous letters we received, which kind of led to us even taking a look at this and going back through some of the testimony that was submitted. And it's almost everything you guys have proposed is responsive to the concerns that people were raising and the worries that they had, the challenges that they were facing, and even completing some of the grants applications. And so I think this is really responsive to a lot of different needs and concerns. So thank you for all the work that has gone into this.
Thank you so much.
Thank you, Mayor Gaskins. The question I have actually comes at this, I think, from the opposite space as my colleague, Councilman Chapman. I keep thinking about the ARISE program because when you read the report, there are so many programs touching on so many different things. And what the ARISE program did is to sort of turn that concept on its head, right? And said, rather than build a food program, a housing program, we're going to just give people money and they will respond to their month-to-month needs, sort of stability, and we might not be there yet. This report and this proposal, I think, I love what it does and the definitions and and the recommendations, but I guess as we move forward, I want to keep the ARISE program sort of in the conversation and in the evaluation process, like maybe not for this cycle, but the next time we do this, because it feels like the lesson from that was, you simplify the program, you simplify administrative overhead, you give people choice and dignity, and you spend potentially a similar amount of money. I see $1.92 million. And so I don't have a question or a change, and I appreciate the recommendations, but I think for me, I want to keep universal basic income in the conversation. And this is such a substantial pot trying to address many of the things that people used universal basic income to address, childcare and food and housing and healthcare. So I'll admit I've only had time to sort of skim, the full report, and so I wasn't sure if this was maybe addressed in there, that concept. But I don't know. I don't know if Director Garvey, if you have any kind of reaction or thoughts on that, if there's a place in the future or in our methodology for an ARISE type program to have a place in this fund?
Without a doubt, in my dreams, yes. But it is sort of what this fund has always been challenged with is the spread of the impact. When we're talking 30,000 people impacted with a 1.9, and with ARISE, we were able to support 170 families. And so, but I do think your point is so well taken in terms of the values and the elements that we're talking about related to respect and personal choice, and also the recognition of comprehensive needs or comprehensive responses. So I think for us, we're always looking for other ways to figure out, is there some way that we could do something like ARISE? I was just at a conference where an RX Babies project that's focusing on providing funding for mothers for a period of time using TANF dollars and other things. So we're always still looking at, is there a way we could replicate this, knowing that the city can't sustain that. So I do think I don't want it to be an either or. I would like, just as you're saying, could we make sure that we're imbuing the values of that work, as well as recognizing that economic security is fundamental to every single thing that we're going to do. So I think those are the pieces that we'd want to work on while we are also pursuing alternative approaches or other ways to try to replicate that.
No, I appreciate that. And like I said, I don't have a solution here tonight. And I understand the difference between 30,000 people and, 500 people, 600 people in those households. But the principles that you enunciated are also well served by a universal basic income program. So, this is, we do need a motion on this item if we're prepared to move forward. And it would be setting it for a public hearing on Saturday the 14th for a final evaluation, if anybody's interested.
So moved.
There's the motion.
Second.
I'm going to give the mayor the second on that one. We've got a motion by Councilman Chapman, a second by Mayor Gaskins. Any further discussion or comment on this item? Councilman Pike.
I didn't have any questions, or I didn't want to take time then, but I just say I read about half of it. I'll get through it before Saturday, but it's very deep, thoughtful work, and I really appreciate it. I think it's going to help us make better decisions on what to do with this very important but limited source of funding going forward in our budgeting process. So thank you all.
Thank you for saying that. And I do really want to acknowledge Community Science was such a tremendous partner for us. And they were so just tuned into Alexandria and really working so hard to try to support what we were trying to do, and a whole team doing that. So we just want to rave about them, and they were so helpful. And I have to acknowledge Federico Gutierrez's leadership and work to keeping the fund the way that it is, and supporting its advancement also. So, and I know I'm not supposed to speak on that part, so that's point of order.
Well, I don't know what you can and can't say tonight, so that's fine. All right, well, we have thank you, Councilman Pike. And so there's a motion and a second on the floor. This is a voice vote, so all those in favor, please say aye. Aye. Any opposed? No. Any abstentions? No. It is unanimously moved on to Saturday. Thank you all.